Welcome to the CR Dynamics podcast. I am Chad Rauch, operations leader, founder, and someone who believes that how you run your business is just as important as what your business does. Today's guest has been doing something most people in healthcare have not figured out, building an organization that does not just deliver, it solves problems that other organizations cannot solve on their own. Iqbal Shariff is the founder, CEO, and president of Best Home Healthcare Network, a Chicago-based home health agency he has been building since 2006. BHHN was the first home healthcare program in Chicagoland to put a clinical pharmacist on the care team. It made the Inc. 5000 in 2018 and has been operating under a high performance network model long before that term became fashionable. Today, we're going to talk about what it took to build that model, how you operate a performance-based clinical organization in one of the most complex home health networks in the country, and what Iqbal sees coming next. Iqbal, welcome to the show.
Thanks so much, Chad. I truly appreciate it. I can't wait to our conversation.
And we had some great conversations starting off in kind of a very unique angle, the home healthcare market. Being on the outskirts of Chicago, it is something different. You see them all the time and kind of it's a different aspect and kind of how you separated yourself from the rest of the business. So you've been building BHHN, a lot shorter to say than the Best Home Health Network, so abbreviations here, since 2006. Just walk me through those early days and where the patient safety mission came from.
Yeah. So great question. So let me start with patient safety. I got an MBA at the Loyola Healthcare Executive MBA and for healthcare executives. And one of our professors, Professor Barbara, great professor, and in our class is dynamic. You've got providers, you've got non-providers, you got non-clinicians like me and clinicians, other leaders around the Chicagoland area, Cook County area. And one of the classes was patient safety, and that really got to me because she said, Professor Barbara, and she has a book, about patient safety. But in the beginning of the class, she discussed what is patient safety, and really from the Institute of Medicine. So the Institute of Medicine in 1999 did a study, and that study was very scary to me. It said that if I told you that a airplane were to malfunction in midair, or as they said, explode, and it had made the headlines in the news every day, one per day, how trusting would you be of the airline industry? And everyone in class was like, we would not be trusting. The book says that many people would say that most would not trust the airline industry. And the Institute of Medicine later on wrote that, what if I told you that's healthcare? That's how many potential medical errors occur, inside the hospital, inside healthcare, and that was an eye opener. And patient safety is really everyone's job. It's to prevent preventable medical errors, and it's just a diverse field that's been studied since 1999. And I'd like to say that things that the IOM cited, it's a field that we've been all, as a healthcare industry, has been striving to as a field, as an industry. And for me, it's important that that's embedded in our tagline, because if any time any clinician or out on the field or anyone in the office, doesn't matter where they are in our or in the organizational chart, that's their north. Patient safety is their North Star. Preventing preventable medical errors is the North Star. So if it's so, for example, one common dilemma that we hear from hospitals and discharge planners and our peers that we work with, they will assign us complex cases, and we ask them, thank you so much for offering us the opportunity to care for this patient. One thing that they'll rattle off, and when I say rattle off, and rattle off is, I'm so glad you guys are taking care of this patient. We had this patient come back because the other organizations that were responsible for the care of the patient, other home health care agencies, they opted towards more of a cost-efficient care, and that's why they come back. And for us, the way we understand patient safety is our goal is preventing medical errors. That comes number one. Everything else, is number two. And so that's where patient safety is a critical role in decisions we make inside of our organization, inside these walls that we're in, or whichever walls we're in for that matter, whether it's the patient's home or whatnot. It gives autonomy for the clinicians out in the field and in the office to know that, hey, you know what, I feel safe making the right call, and not being pressured to make a call that prevents me to provide the best possible care for the patient at that time.
No, that's the North Star, the patient safety kind of. You mentioned even in your example here that other were focused on more of a lower cost
Yeah.
healthcare solution, right? That doesn't seem to, it's counterintuitive in the sense that it doesn't seem to be putting that patient safety first, that lower cost doesn't usually mean the best care. And so you advocated for Medicaid patients when it was not the lucrative thing to do. What made that the right call?
Yes, those same two words, Chad, those same two words, patient safety. It's preventing preventable medical errors. We'd receive calls after healthcare reform was passed, and
Okay.
these calls were patients saying, "Hey, you know what?" And let's put context to this, Chad. Let's look back.
Okay.
You know, 2012 was the first time people had a card in their hands and said, "Hey, I got to go to the hospital, for the first time. If anything happens, I have a primary care physician for the first time. Otherwise, there's a class of people that couldn't afford it and they had to pay out of pocket to go see a physician. And if they had any sort of medical emergencies, they'd go straight to the hospital. This is 2011, by the way. Fast forward to
Okay.
2012, people had insurance card. And what I've learned, what our organization studied prior to this unraveling, healthcare reform unraveling, is this case study in Boston. When people had an insurance card, for the first time, people would flock to the ER. And it took a learning curve for them to start migrate into the PCP's office and say, hey, you know what, my PCP is the first point of contact. And
Okay.
so we saw that exact same thing happen in our marketplace here in Chicago. People had their card for the first time. And when they saw any signs of issues, they'd go straight to the hospital, and we'd receive phone calls from patients' kids saying, "Hey, listen, I know it's a financial issue, but can you please take care of our parents? You know,
Mhm.
they're in need of home healthcare services." And everyone's saying, no, can you please say yes to this? And me and my business partner, Angie, we look at each other, we're saying, yes, of course, we definitely do that. And as we get more and more phone calls for this, and keep in mind during this time, home healthcare was reimbursed at cost, for the labor that was there.
Okay.
So there's no wiggle room for administrative pay and whatnot. We had to create a model at that time that allowed us to be successful Medicaid patient population.
Mhm.
And that's when we said, hey, you know what, we need to really dig deeper, really understand what the issue is, what it means how can we help the patients win. And we advocated for them. We talked to the health plans and told them, hey, we have this problem, and you're going to pay for it one way or another, and then they come out of their pocketbook. And once we described it like that, many of the health plans jumped ship and said, hey, we want to work with you. We want to pay you a premium. And
Mhm.
by paying them premium, we're also delivering value that we volunteered to offer, which is reduce readmissions in the hospitals, reduce cost curves for scenarios like chronic illnesses, and a bit more. So for us, we listening to the voices of the patient, and seeing what's going on, and looking at the two words that's attached to our logo, which is patient safety. Those two things, is what triggered us and set the foundations for our strategic path during that period of time prior to the pandemic.
No, that's it's kind of funny how you say, I don't want to say funny, but it's kind of typical. You get something, and so your first reaction is to go to the big building. You have a situation, it's there, everybody sees the big ones. The PCPs, the primary cares are secondary. I only go there for the annual checkups. I got a situation, I'm sick. You go to where you think you're going to get the best care, and really you don't. The best care is at home, right? I mean, is being proactive, is staying on top of it. So being leading edge and adopting that early philosophy kind of sets you up for success right away, doing something different than somebody else has. And kind of also during that time, maybe a little bit after, you ran a tabletop exercise, right? Yeah, for the
Yeah.
potential shutdown. You know, the what if scenario, everybody's seen the old movie Outbreak, and then all of a sudden, outbreak happened with COVID. Most agencies scrambled. You guys, BHNN, was one of the only ones that was still running and still able to take care. What does that tell you about how you built your agency from the ground up? How did you become prepared for the unknown when people weren't even preparing yet?
Yeah, I mean, those two words, patient safety, it's building on the momentum from our earlier success and earlier practice and listening to the voice of the patient. But this time, the situation is a little bit different. This time, we're seeing one country after another shutting down. And we knew that at some point, if we're seeing a domino effect, it's going to hit us. So
Mhm.
went ahead and we purchased PPEs ahead of time in the event that we might find ourselves in some sort of a shutdown. And by being ahead, we were able to stay ahead. And many of the healthcare providers and hospitals and health plans were thankful for those that decision we made, because hospitals were trying to take people out of the hospital as soon as possible, and especially the ones that were not sick with
Mhm.
and and the people that were sick with COVID, they need a reliable partner that can be responsible inside the patient's home and not be an agent of spreading it,
Okay.
being responsible with the right equipment. At that time, skilled nursing facilities and other organizations, they had to reuse some of the things that they had. It was a struggle, but we were in abundance, and all of our clinicians and our clinicians were, I'm just very thankful for the clinicians that we had. They're very brave. They're very they're veterans. They were
Mhm.
I'd like to say the gold class of nursing and the in-home healthcare service. And they
Yeah.
they weren't phased by this, and they really led the organization at that time in terms of infection control and helping all the patients stay calm and relax during this new time, new thing that we're all experiencing.
Mhm.
So I mean, it's a testament to the clinicians and their bravery, their courage, the courage within our office staff to wave the flag of patient safety and unwavering and relentlessly and saying, hey, we're gonna move forward and uh, do what's best for the patient population and prevent any sort of medical errors in this context of the pandemic.
Well, it's kind of, I mean, the unsung heroes. I remember back in that time, it was the nurses, the doctors, the hospital staff that was the brunt of it, getting all the recognition. But you played the same important role from the spread, the patient safety, like you keep mentioning, but you didn't get the credit for it. It was something. So I mean, that's a testament to how you guys just handled your business. It's safety first, patient safety matters, recognition follows by making sure your patients are safe. It's kind of that, from a manufacturing perspective, you're on the operating floor, the operations floor, no guts, no glory. The salesmen, the marketing teams, they get all the product, but the guys doing the hard work are the unsung heroes. And that's the same thing. I can see you have the same clinical staff, you have the same nurses, you're just in a different role. You're not in that, we'll call it the marketplace for recognition in a sense. So no, kudos to you guys in handling that. I mean, it was a very tough time for everybody, and opportunists succeed, and you prepared for the battle and you
Thank you.
succeeded by that preparedness. So talking about kind of that preparedness and how you're building the high performance network, it's not your traditional home healthcare, right? We just kind of talked about that. What specific operational decisions moved you from one to the other? Kind of what was that resistance did you turn in to start making those changes? How did you jump from traditional to forward thinking and being ahead of the storms?
A lot of it had to do with the way we understand ourselves. Once again, it comes back to those two words, patient safety. Let's head back a couple years before the pandemic. We listen to the people we work with. In some cases, the customer, right? We listen to the patients, we listen to the customer. I want to give you an example of how we listen to one of our customers, one of our clients, which is a Medicare Advantage plan, responsible for, I believe, teachers and educational institutions at that time. And we were talking to leadership, and leadership said, hey, we're having a little bit of an issue here with managing
Mhm.
the medication costs, and people are just going to another higher level of cost curve, and but right now we have difficulty managing the medication costs. Just want to know if you have any insights on that. And I said, yeah, we have some insights on that. We actually see that on our end as well. Our clinicians see that on the daily, on the daily, on some
Mhm.
occasions, and so what will happen is that a clinician will be taking care of a patient when they're at home. And they'll have two sets of medicine, the medicine that they had before hospitalization and the medicine that they have after hospitalization. Things that their primary care physician offered and the things that the hospital provided them. And sometimes they look at these two sets of medications. What do I do? And there's a bit of confusion from the patient's end. And
I
our
can imagine.
nurse's job is to reconcile them and help them and seek guidance from the physician. However, that's just the standard practice that of a standard home healthcare
Mhm.
agency that we do. What we did with the health plan is that, hey, we can help you reduce those costs. We can embed a clinician, a pharmacist, to make home care visits and provide medication therapeutic management, MTM. And what we found was that 3.1 drug therapy problems. Either the drug was too high, it's too low, it's missing a drug, or need of additional drug. And we saved roughly around $2,000 per patient per year. And that's a lot of money for a health plan. And that's a big win for the patient because now they're getting medication that's appropriate to them and their
Mhm.
condition, and in their home environment and the environment they live in. So, that's one example of us uh, working closely with a health plan to help them achieve the goals that they're trying to achieve, and at the same time help the patient win. Help the patient
Mhm.
get better, and it's all underneath. Um, it's based on the data sets that we have. It's based on the data sets that the health plan has. When we collaborate and work together, and good things, the patients win. They
Mhm.
win big time.
Well, I mean, the patient safety centric focus as the
Yeah,
core business model is allowing other people to take advantage of that. And I say take advantage of it not in a I'm going to get something past you, but in a good way. So you take the relationship, you listen to your customers, keep your focus, your North Star of patient safety, and out of that, there's a cost savings for the patients. That $2,000 example. And if you're on a Medicaid, you're at home healthcare, $2,000 is a lot. Let's be honest. I mean, we're not talking nickels and dimes here. We're talking about real money that can be substantial in those situations. But then also you're helping the customer on their side of things because they can control their costs. They can be more predictive spending on a larger scale when they're dealing with thousands of patients, not just one. So take the economy scale there. But the cool thing about it is it's the patient safety that drove it. It's
yeah,
that focusing on the patient. It's not, you hear those things, oh, I'm lowering costs and I'm doing this, and they start stripping things away. You brought value to your organization, a cost that's to you, but then you're still driving cost reductions off of it. So that's a great way to take advantage of a system or a opportunity that's beneficial for the whole system as a whole, not just one part or the other. So I mean, let's talk about operating at scale. Now you have the ability to grow. You have a solution that, assuming others took advantage of, right? You proven a case point. Hey, now that gets your notoriety, more visibility to other providers that want to partner with you. So that's excellent. So we're talking about the scale and we'll talk about what's next. And you're running you mentioned about 40 to 50 staff, about 100 touch points a day in Chicago. And for the audience out there, Chicago is not the easiest place to travel around. There is traffic, what do you say, the third largest market in the United States, but in surrounding counties. So building a performance culture in a field-based clinical organization is a different problem than building one in a facility. You got to get around how do you actually make the day work day to day? How do you manage the space, the travel time to hit these many patients?
Yeah, so no, there's a lot of layers to that, right? I'm gonna go a little kayfabe, in professional wrestling, there's something called kayfabe. It's like we really have to drill down. We really drill down. Our goal is to minimize the operations and make it as pristine as a software would run. So we have more time to address spur of the moment, the things that if it could go wrong, would go wrong, Murphy's Law. And so one of the things that we would do is we have our the industry standards. You know,
Mhm.
uh, for us, it's CHAPS, it's Community Health Accreditation Program. We have Medicare condition of participation. We have our policies, procedures, and then we have our day-to-day tasks. For the operations. We make it very clear within the job description. We make it very clear from the interview to the orientation to the performance reviews and to the daily reporting. We have all that embedded so that every person, every time, every day knows what they have to do. They get a briefing in the morning. They know what they have to do. It comes in their mailbox, at 10:10 in the morning. They execute on it. And then we have the rest of the day or somewhere in the middle of the day for the surprises that happen, because, healthcare is filled with surprises, so yeah, the nature of what we do. So we want to minimize the amount of time it takes to do the basic work that we have to
Yeah.
do to run the organization and maximize the time for those activities that are inevitable. Yeah.
No, I mean, I think they say kind of regardless of the industry you're in, healthcare, manufacturing, finance, it's building a solid foundation, establishing that base. You mentioned the standard work, kind of the SOPs, the onboarding. I mean, you have alignment throughout the organization and how you want to operate. And that, I mean, how you scale. You have to have the policies, you got to have the procedures, you got to have that foundation in place before you can even build a roof. So taking that to the heart, and I'm assuming all your alignment goes back to patient safety, that North Star.
Yeah,
So,
actually, patient safety is one layer of it, because patient safety it's embedded within the organization through
yep.
the best practices, the CHAPS, Medicare participation. Patient safety has a little bit more courage involved, to make those decisions, and that's also tied towards, which is important, is to our financial forecast. I know it's a little bit away from patient safety, but if we're
Yeah.
not a viable organization, we can't offer patient safety. Having every single task that's being tied directly to the forecast, and everybody knows that their role on this day, if they don't such and such task, it's going to set back the forecast or alter the forecast by days or the metric we use. It either sets it forward, backwards, and we want to make it as accurate as possible so that wiggle room. You have to have a fortress, a financial fortress when it comes to patient safety, because if you need to have a little bit of funds for the unexpected. What if something happens to a health plan and become insolvent or and not viable? You have to make sure that you're going to go out there and continue to provide the care, that they need, and not just say, hey, well, I'm so sorry, your health plan's not paying, so we're going to have to jump ship, which is something we've heard hospital discharge planners and clinics time and time again tell us that, as one of their top concerns when partnering with the home health care agency. So
Mhm.
for us, it's very clear that patient
Yeah.
safety is like dynamic, this element of courage, and this element of like, having a strong operations for forecasting. That's embedded in every single task in our 10/10 meetings and whatnot. And everyone knows very clearly how timeliness and quality work, their activities and their influence to the forecast. And we know if we're on time, ahead of time, or lagging, and embedded in it all, it's all aligned.
I'm assuming, and I'm going to take a leap of faith here. Your
Yeah.
10-10 meeting is your daily stand-up meeting. You get all your clinicians on order. You're talking about the structure of the day, correct? I mean,
Correct.
I see that in manufacturing worlds all the time. They have that at your leadership standard work, your daily tier practice. It's exciting to see that you're taking it in a very unique approach from the home care agency. You're taking that philosophy that we'll call it the lean organization in a sense that, and you're carrying it into an industry that nobody really thinks about where those tools can be applied to, but how you structure it to that safety and how everything's aligned to that is is an excellent kind of core philosophy. And I love how that's built up into it. That's kind of, it's exciting. But now that you have that philosophy, we've talked about expanding into new geographies. How do you take what you do in Chicagoland? Granted, it is not small, it's big, but how do you take that and you expand? Is it partnering with other agencies, developing and passing off your process, or explain that kind of next phase on growth for you guys?
Absolutely. So as a home healthcare agency, we're the way we envision ourselves to grow in is both augmenting our services to augmenting our home healthcare line and also growing into other marketplaces. We've received a lot of feedback in the past 6 to 12 months, where organizations, hospitals, health plans are saying, hey, we need to have a more disciplined approach to lower cost of care that's a little bit more long term. And what we in our conversations and the research that we've done with the people that we work with, home care is the next step for our organization to provide more opportunities to keep the patient safe at home. And so that's something that August 1st we're going to have launched of this August 1st of 2026 is a caregiving service and help reduce the cost of care to the health plans and keep the patients safe at home and not expend money on ambulance care to go to the hospital or go to the of course if they need to go they need to go, but if it's unnecessary and it's preventable that's where we're currently training our caregiving staff, guide them for those situations based on the insights we receive from clinicians that are in patients' driveways and providing home health care services. So that's our immediate next steps. Or balance of the decade of next between the balance of the decade and the next decade, we have a prophecy. That prophecy is to that we know that we have the capabilities to save the state of Illinois $100 million year over year. It's just a matter of the state of Illinois raising their hand and say, hey, you know what, Iqbal, I want to learn more about how we can achieve that. And that's what we really want to do is to invest into Illinois and make that work. Now, if another government, let's say West Virginia or Miami or other government entities want to work with us in the meantime or raise their hand first, we're going to be 100% dedicated to that organization as well. So our goal, and it all comes under the umbrella of patient safety.
I love how you ended the talk on patient safety, because that was going to be the first point I was going to bring up, is how everything you've aligned, everything we've talked about, there's been one core theme, and everything builds off of that, and that's patient safety. So, Iqbal, I really want to say this has been a genuinely useful conversation. I loved it. I think there was a lot of great insights, but I do want to take up and summarize a few of the main takeaways that I got out of this. And one is, like I mentioned, patient safety. It's not your tagline. It's built into every foundation throughout. Every decision has been taking Medicaid patients. It's not lucrative, but you're added the pharmacist to the team. You're doing everything that talks about patient safety and putting that first. That also allowed you to jump into growth by taking that model of patient safety. So then the second thing is you develop the high performance network based on that, not as your marketing position, but the proof that patients do come first. And when you solve a problem, everybody can benefit around you. So you're taking that around you and you're growing that. And then the last thing, and for people not in the state of Illinois, you're probably not going to see a lot of people raising their hand high in Springfield, and more like on the low key standpoint, but you're taking that operational philosophy, that discipline, that structure that we talked about, how it's embedded in your network, and that you're building that into growth and expanding that to the caregiving service. That's that next evolution. But it all goes back to the patient first, patient safety aspect. So those were my big takeaways. I hope everybody learns a lot from how you structured, how you put safety first. But one final question to you, and I ask this a lot, I tweak it up a little bit of some of the guests here, but the World Cup is around. So who are you rooting for this year?
I don't really watch soccer,
Okay.
but of course I'm rooting for the USA, so
Okay.
it's our bicentennial, so they should take it home this year, right?
Let's hope.
But
It's kind of not that's a good point. Not even thinking about the bicentennial aspect of things, but having the World Cup on a 250th anniversary of America would be great to see us even advance beyond the first round, get into some actual good match plays. But appreciate your time today. Any last questions or any last things you want to say?
No, I appreciate the time, and if anyone has any questions, you could go to our website www.bhhq.com or hit me up on LinkedIn and or talk to Chad right here, and more than happy to connect with either one of us. So thank you so much for the time, Chad. Really, truly was an honor.
No, thank you for your time. I mean, being straight about how everything works for everybody listening. Iqbal's organization is Best Home Healthcare Network. Links will be in the notes. Iqbal, appreciate you. Appreciate your time today and good things to come. I guarantee it. So thank you guys.
Thank you.
All right. So that's a wrap.